Today, we're digging into a really critical connection for your eye health that honestly gets overlooked way too often, the link between diabetes and age-related macular degeneration.
Look, if you have diabetes, I'm sure you've been told all about diabetic retinopathy. It's the big one, the complication everyone warns you about. But what if I told you that new science is uncovering a totally different and maybe even sneakier threat, one that directly connects your blood sugar to another huge cause of vision loss?
All right, let's get right into it. We're going to go way beyond the usual conversation about retinopathy to explore this really surprising link between diabetes and a condition called AMD. So, first things first, what exactly is AMD? Well, it's the #1 reason for irreversible vision loss in older adults. It usually starts out as this dry form, which is kind of a slow burn deterioration of the cells in your retina. But for some people, it can shift gears and turn into the wet form, and that's the really aggressive stage. It's where these new, faulty blood vessels start to grow and leak, causing fast and severe damage. In fact, this wet form is responsible for almost all of the legal blindness that comes from AMD.
So what on earth connects this major eye disease to diabetes? For a long time, the studies were kinda all over the place, but now a much clearer picture is starting to form. Let's take a look at how scientists finally connected the dots. Yeah, for the longest time, the research was confusing. You'd see one study that showed a link and another that didn't. But as the science got better and researchers started looking at bigger groups of people, all the clues started pointing in the same direction. What used to be just a hunch is now backed by some really solid evidence. And that evidence is pretty powerful. A big recent analysis that pulled together a bunch of studies found that people with diabetes have a 1.44 times higher risk of getting AMD. Now, that's not some small, insignificant number. It's a major statistical link that basically confirms diabetes is a huge risk factor. Now this is where it gets really fascinating. The risk for that more dangerous wet AMD isn't just a flat number. This study from 2023 shows it's a sliding scale. You can see that even being newly diagnosed with diabetes bumps up your risk, but the longer you have it, the higher the danger climbs, all the way up to more than 1.5 times the normal risk if you've had diabetes for 5 years or more.
But here is the absolute jaw-dropper, the thing that really caught researchers off guard. It's not just about how long you've had diabetes or even how well you manage your blood sugar. It turns out the age you were diagnosed is a massive risk factor all on its own. And this chart just lays it all out, plain as day. Look at this. If you were diagnosed with type 2 diabetes before you were 45, your risk for AMD is a staggering 2.7 times higher. That's huge. And you can see the risk goes down the older you are when you're diagnosed. It really suggests that getting diabetes early in life somehow kicks off a more aggressive process, making your eyes more vulnerable over the long haul.
Okay, so the link is there, it's solid, but why? I mean, what is actually happening inside the body that ties high blood sugar to the breakdown of your macula? Well, the answer is that they share a few common enemies. Think of these as the biological culprits that are causing trouble in both diseases. Both diabetes and AMD are fueled by things like chronic inflammation, cellular damage from oxidative stress, and a buildup of these nasty compounds called AGEs. But there's one bad guy in particular that really stands out.
And its name is VEGF. That stands for Vascular Endothelial Growth Factor. Now, normally VEGF is a good guy. It helps your body grow new blood vessels when you need them for healing. But in eye diseases, the body goes into overdrive and just starts pumping out way too much of it. And that overproduction leads to the growth of all these weak, leaky, abnormal blood vessels that just wreak havoc on the retina.
And this is where it all clicks into place. In wet AMD, that excess VEGF is the main engine driving that destructive blood vessel growth. And in advanced diabetic eye disease, high blood sugar also triggers the body to produce too much, you guessed it, VEGF. It causes almost the exact same problem. It's literally the same villain playing the same destructive role in two different stories.
And if you need that final piece of proof, the absolute smoking gun, here it is. The best, most effective treatment we have for both wet AMD and severe diabetic eye disease is the exact same class of drugs, anti-VEGF injections. When the treatment is the same, you know the underlying problem is the same. It's undeniable.
So, that's a lot of science. The big question is, what do we do with all this information? Let's talk about an action plan, because knowing this stuff can seriously empower you to protect your own vision.
Okay, first, let's talk to those of you who've been diagnosed with the more common dry AMD.
For you, this research is a massive wake-up call. Your eye health and your metabolic health are now officially linked. Doing everything you can to prevent or just delay diabetes could be the single most important thing you do to stop your AMD from turning into the much more dangerous wet form.
So the game plan here is pretty straightforward, and it's all about that metabolic health. We're talking about maintaining a healthy weight, switching to a diet that's low in sugar and high in anti-inflammatory foods, like a Mediterranean diet, slashing those refined carbs, staying active, and of course, a big one, do not smoke. It's a huge risk factor for both of these conditions. All right, now what if you already have diabetes? Well, this means you need a little shift in your mindset. Your yearly eye exam is no longer just about checking for retinopathy. You have to realize that you are now in a high-risk group for AMD, and you've got to be proactive about it.
This means you need to be your own advocate. Walk into your eye doctor's office and specifically ask them for an AMD screening. And this is absolutely crucial if you fit into that high-risk profile we talked about. Diagnosed young, you use insulin, you've had diabetes for a while, or you also have high blood pressure. Don't just assume they're checking for it. Ask the question.
Okay, let's pull all this together. This connection between diabetes and AMD really forces us to adopt a new, more integrated way of thinking about our eye health.
If you take one thing away from all this, let it be this. Your metabolic health and your macular health are not two separate issues. They are not in different buckets. They are deeply, biologically, fundamentally intertwined. What happens with your blood sugar has a direct impact on your risk for one of the leading causes of blindness, period.
And you know, this connection is so strong that we're now even seeing hints that some diabetes medications might pull double duty. Early research is suggesting that drugs like metformin might actually have a protective effect, potentially lowering the risk of developing AMD. It just further proves how connected these two things are.
So we'll end on this thought. All that inflammation, the oxidative stress, the damage to blood vessels, it's the same story. It's being told by your body, and it's being told by your eyes. The only question is, now that you know, are you prepared to listen to both?